All right, everybody. This is Kirk Ream from Transformation Training and Fitness. Here to present you with a presentation on foam rolling. I'm sure you've heard we've been doing some clinics on the importance of foam rolling in our facility at Transformation Training and Fitness. And some of you maybe don't live in the area or you haven't been able to make the clinic time. So what I decided to do is just put this little presentation together for you just to cover everything we've done there at our facility. So foam rolling is really important, and there's too much research out there to ignore it. So what we wanted to do is we just put together a little presentation, take about 15 minutes to get through this, so let's get right into it. So foam rolling is a form of self-massage. It's also known as self-myofascial release, or SMR. And what it is, it's just foam, foam roller, foam cylinder. They come in lengths of 12 inches or 36 inches. We actually really prefer the shorter 12-inch one at the gym because of the versatility, but you can get them in 36-inch lengths as well. And basically what you do is you give yourself a self-massage. So everybody knows the benefits of massage. I mean, that's been well documented over the years. A lot of people visit a massage therapist on a regular basis, which is great. The one drawback of that, of going to the therapist, is time. Obviously, you have to make an appointment, go there. The appointment may only be a half hour, but with drive time and everything, you're looking at well over an hour. And then, of course, cost. Massages can run anywhere from $40 to $60 to $100 an hour, something like that. So the foam roller was designed to kind of help you get the results of a massage in a very short amount of time, and it's not meant to replace a massage therapist, certainly, but it's meant to supplement what they do. So let's get into the benefits. Let's just go through these here. That lessens the effects of muscle soreness and fatigue. All right, so everybody can use that. Increases soft tissue quality, and we'll talk more about what that is in the next couple slides, but basically what we want to do is we want to make the muscles basically return or act how they should. Okay, so these next couple points: increases muscle activation, increases performance. All these things go along with increasing this soft tissue quality, and I'll talk about why that happens in the next couple slides. Foam rolling also can decrease pain. So if you're having pain in an area, foam rolling can help that. And in the long run, one of the main components of foam rolling is it decreases injury. All right, so by increasing this tissue quality and by increasing muscle activation, what's going to happen is you're going to improve performance. The muscles and the body are going to move as they should, so you're going to decrease injury and also decrease pain. All right, so who should foam roll? Well, if you're a runner, you should definitely be foam rolling, especially if you're running a lot. So if you're logging miles each day, each week, you definitely need to find some time to do some foam rolling. There's just too much overuse there of muscles to ignore that. High school athletes, and when I say athletes, we consider all of the kids we train athletes, whether they're involved in sports or not. We want them to perform like athletes. So ages 14 plus is probably, we would start them as young as 14 plus. What happens is around that age, maybe a little bit earlier than that, the muscles start to get tight. So we need to introduce foam rolling into their workouts, into their lifestyle. The other thing that's happening now is obviously kids are playing sports. If they're involved in soccer, basketball, football, whatever it may be, lacrosse, they may be playing every day, all year long. So what we really need to do is make sure they're getting recovery, make sure they're warming up properly so they do play as well as they could, certainly, but also decrease injury, the chances of injury by all the overuse that they're getting. The general fitness enthusiast should also be rolling. And I'll talk about when you should do that, why you should do that in the next couple slides. But if you're just, you're not involved in any type of sports, you're not a runner so much, but you just like to go to the gym, work out, stay healthy, all those things, you need to add rolling in. I miss the weekend warriors. You know, if you're one of those who, you know, on the weekends does the 5Ks, maybe you're playing in an adult basketball league or soccer or whatever the sport of your choice is on the weekends, you need to add in rolling again, because it's just going to do too many. There's too many benefits of it to just ignore. So basically everybody should be rolling. Again, we'd probably start most people ages 14 and up. We try to add those in with our athletes at that age, and from there on up, we really think you should be finding time to roll throughout the day, throughout the week. So how does foam rolling work? Well, basically, as I said before, it's a form of self-myofascial release. All right, so the fascia, if you look at that picture there at the bottom of the screen, the fascia is the covering of the muscle. The best kind of visual I can give for this, other than a picture, is if you've ever handled a chicken breast. You know that slimy covering of a chicken breast. That's the fascia. So the fascia covers the muscles. It covers the muscles. It actually covers the muscle fibers into the tendons. And what happens is little knots are formed in the fascia. Now, nobody's sure why these knots are formed, but there's a good chance it's because of overstimulation. For some reason, a muscle stays, it's overstimulated, it's too active, and this little knot will form. So what the rolling does, you're basically just massaging out those knots. You know, you're going to apply pressure from the roller over those knots, over the muscle, and in turn increase the soft tissue quality, increase the quality of the muscle, breaking up the knots, removing the knots, so that the muscle returns to the tissue quality that it should be. So you may be thinking, so what? What's the big deal? Well, let me give you an example of why this is important to add into your daily routine, or at least on days you work out. So let's say you have tightness or soreness in one muscle group, okay? Let me give you the example of everybody knows the song, knee bones connected to the thigh bone, so on and so forth. Well, let's say you have muscle soreness in your calf, okay? Now keep in mind that everything is connected, just like that song says. The knee bone's connected to the thigh bone's connected to the hip bone, so on and so forth. For some reason, we get caught up in compartmentalizing things, so we think, well, my calf is hurt. My calf is tight, it doesn't affect anything else. But the truth is, just a slight tightness in the calf is going to prevent your ankle and your knee from functioning the way they're supposed to. So if that calf is tight and you don't take care of that, or work to improve the tightness there, the soreness there, work to get rid of that, the knee and ankle aren't going to function the way they should. If they're not functioning the way they should, that's going to cause the quadriceps, which is the front of the top of the leg, to take on too much pressure and do too much work. All right, so now if they become too tight, or if they're doing things they shouldn't be, now the hip's not going to function properly. The quadricep muscles lead into across the hip flexors into the lower abdomen, into the core area, which is going to make your pelvis rotate forward, possibly backward, depending on you know, the soreness and the tightness. And then once you get into the pelvis moving, and the pelvis tilting one way or the other, now you're talking about back issues and things like that. All of that just from a from a tightness and soreness in the calf area. All right, now the same can be applied, you know, maybe your calves are fine, but your hamstrings are tight. All right, the same scenario can exist. So what we need to do is just get rid of that tightness, get rid of that soreness, improve the tissue quality so that the joints can function properly, and that's how we're going to avoid injury, and that's how we're going to increase performance. All right, so now that you know why you should roll and how it works, all right, let's talk about when you should roll. Ideally, in a perfect situation, you're about to work out. Maybe you're about to go for a run. Well, hopefully you're warming up, and hopefully you're doing some type of dynamic warm-up before you get into your activity. So The ideal time to roll is before your warm-up. So let's say you go to the gym. First thing you want to do, grab your roller and go through your routine. And we'll go through those moves here in a little bit. If you can't do it before you warm up, let's say you're running late. Obviously, we don't live in an ideal world. You're running late. You only have 20 minutes to work out. If you roll, that's going to take 5 to 10 minutes. Now you're only going to have 10 minutes. Then try to put it in after your workout. All right, so if you're late for a class, late for a session, roll after the workout. But if neither of those times work, maybe you only work out on you have a half hour for lunch, you're going to run down to the gym, work out, whatever. You only have a half hour, then fit that rolling in anytime throughout the day. You can, the beauty of foam rolling is that it's going to improve tissue quality, but it doesn't really fatigue the muscle at all. So you can, add that 5 minutes in of rolling in the morning when you get up at night. Like I said, ideally it's before you work out, but if not, just work on it throughout the day when you have time. All right, so rolling, there's a certain technique to rolling that you need to be aware of. We're going to go over 7 muscle groups that you're going to roll, but what you really need to focus on is how you should do that. So what you're going to do, each muscle group you're going to roll for about 30 to 60 seconds. And you can see there in the picture that I put up, we're rolling the calf there. So what you would do in that picture is you would just roll from the back of the knee area down to the ankle and roll out the calf, 30 to 60 seconds. If you find that you have a knot somewhere in the calf and in the other areas that I'm going to show you, if you have a knot, just let the pressure of that roller rest on the knot for a little bit, and that'll start to break up the knot, and then you can go back to rolling. You can also just slowly roll back and forth over the knot. If you picture, some Play-Doh on your table, if you have kids or you've played with Play-Doh in the past, you have that big lump of Play-Doh, just think about rolling that out into a smooth, a flat surface. So that's basically what we're doing with the knots and the fascia. All right, make sure you roll the whole muscle group. Sometimes we get caught up on just rolling the area that has the knots. Make sure you roll the entire muscle group. There's a couple different ways you can do that. You can roll, just in that image there of me rolling the calf out, you can take from the back of the knee down halfway through the calf, work on that area, and then from the halfway down the calf to the ankle. You can make that 2 separate movements, or you can roll it as one long movement. That's up to you. Okay, so what should you roll? Now we know who it's for, we know when to do it, we know how to do it, but now what should we do? So we have what we call our Super 7. There's certainly other areas to roll. There's other ways, other areas that you should touch on, but we found that these 7 are the most effective, most efficient for the time that we have in our sessions, and also the problem areas that we've seen people have. So let's go over these. The upper back region, that's the first picture there at the top on the left. That's the upper back, and what you're going to do is just place that roller and work on that. We call it thoracic mobilization, but basically the upper back area. You want to roll over the shoulder blades back and forth. Remember, 30 to 60 seconds. If you find a knot, let the pressure rest on the knot, and then go back to rolling. Second area is the hips. All right, we sit all day, so this upper back area, your shoulders usually are slumped forward if you have a desk job, and also your hip flexors and your hips are tight throughout the day. So this hip movement's a very good one. What you're going to do is just sit on the roller. You're going to cross the leg that you are trying to work on and just roll back and forth over the hip, over the right hip there. And then you would switch sides. On all these things, make sure you do both sides. Then you have the hamstrings, which is the next picture down on the left, the back of the leg there. Just going to roll from basically the back of the knee the whole way up to where the hamstring goes into the butt. All right, so roll back and forth there. Again, 30 to 60 seconds on each one. You can also turn your foot on that one, left or right, to see, to get all angles. There's a couple muscles there in the hamstring, and you can turn your foot left, turn your foot right, and roll different areas. The calves we went over on the previous slide. Again, you're going to roll from the back of the knee down to the ankle. And again, you can turn your foot and work the different areas of the calf there. So that's the back of the body. All right, you have the upper back, you have the hips, you have the hamstrings, and the calves. So you can, again, 30 seconds, 60 seconds on an area. If you find that one area is a little bit tighter, spend a little bit more time on there working those knots out. All right, then you're going to roll over on your stomach, the next picture to the right there. We're going to work the quad. The quad goes from the hip flexor down to the top of the knee. All right, you really want to roll this area out. Now, this is the area that we found, these next two areas, the quads and the IT band, are the two areas that people really have some trouble with. They're overstimulated in the quad, most likely, because their knee and ankles and hips are not functioning the way they should. So what we want to do is improve this quality in the quads, spend some time really rolling those out. Keep in mind, this is going to be painful. When you find a knot, you're going to know it, and it's going to feel painful. But as you work on this daily or every other day, when you have a chance, you want to roll over those areas, and that will help the knots disappear, improve that quality, and the pain will get less. Alright, so that quad there, you're just laying on the roller, rolling from the knee up to the hip flexor. The next one, you can just stay on the same legs, called the IT band. Just turn on your side. It's the bottom picture there on the left. Turn on your side, and this one you're going to basically roll from your hip down your side of your leg to your knee. And again, you can adjust your foot position. Turn your foot left, turn your foot right, so that you can get different areas of the IT band. But this gets very tight on people because of being seated at desk jobs and things like that. So you really want to pay attention to these IT bands. And finally, the inner thigh. That's our seventh one. You can see that last picture on your right is the inner thigh rolling. What you want to do there is actually turn the roller so that it's parallel with your spine. All right, all the other ones, the roller's been perpendicular to your spine. This one, the roller's going to be parallel to your spine. Just roll from the inner part of the knee into the inner thigh, in and out. Again, 30 to 60 seconds, and make sure you switch sides. Do both sides. All right, so that's our Super 7. Again, the whole thing, 5 to 10 minutes. Concentrate on the areas, on all the areas, but really concentrate on the ones that you find that you have tightness in. Now, what will happen is, depending on the workout routine you're doing, you may not have any knots in your calves today, but in a week or two, maybe you've done something differently. Ladies, maybe you've worn some heels. Guys, maybe you've done some climbing or whatever, but knots will pop up. So it's important to continue to go over each of these 7 areas each time you roll to keep the tissue quality up to par. All right, so that's it. I mean, that's it in a nutshell. The importance of foam rolling. Again, there's just too much research out there to ignore it. We want to be more intentional with getting people to start rolling, adding it to their routines, whether it be at the gym, in their workouts, or at home when you get up before you go to bed, or any of the other times you have to roll. So I hope this helps you out. Because of how important this is, we've started to sell rollers. We've put together a manual of everything we've covered here that includes video of each rolling, of each muscle group. We've also thrown in a collection of stretches, static stretches that you can do after you work out to improve recovery time. But again, the manual has obviously picture and descriptions, also has videos. We just think it's too important to ignore. And then also we're selling the rollers as well. So if you do need a roller, if you need the manual, just email us at that email address there, mailbox at transformation-training.net, and we'll get one for you, get started, and hopefully this helps you out. All right, thanks for your time. Have a good day.